Hi, this is Dr. Subramanyam Mahankali. I'm the head of anesthesia at Aster RV Hospital. Fortunately, as an anesthetist, we encounter patients as young as 1 day to as old as more than 100 years old. Nearly two-thirds of the patients who come to hospital and get admitted will see an anesthetist in one way or the other. We essentially form the backbone of the hospital, even though you may not see us every time. My colleagues have spoken to you about various types of anesthesia, various types of pain reliefs, different branches and subspecialties. Running an operating room, operating theaters, is a complex, in how you manage it, because there are patients with various comorbidities, there are various patients with various age groups, the various other medical problems are there. To integrate, we have adopted a lot of good practices from other areas of life. For example, from aviation industry, we have adopted standard operating procedures. We have adopted crew management techniques. The alarms what we use are of different intensity so that we can identify the problems quickly. We've also identified some of the areas where in which, for example, retail industry, how the customer flow is there. For example, in a high reliability industry like nuclear reactors, where error reporting is given importance, we give importance to error reporting. Safety is considered, and also we use a lot of simulation in understanding where things go wrong. You might be wondering, we have adopted best practices even from Formula One industry. For example, the pit stop in Formula One industry is a very important part, where task allocation, checklists are very important. We have adopted task allocations and checklists while transferring patients so that there is nothing which goes wrong while handover of care is being done from one area to other. As responsible citizens and anesthesiologists, what we also want to show is make sure that we understand the environmental impact of what we do. We have incorporated scavenging in the anesthesia rooms or operation rooms. We have reduced the use of volatile gases or anesthetic gases. For example, nitrous oxide, it has been shown that it can be in the atmosphere, at the upper levels of atmosphere, and decrease the levels of ozone. It acts as an ozone depleter. We have reduced its usage to the minimum. The other volatile anesthetic gases, we have reducing it slowly because it acts as a greenhouse gas, which increases the global warming. In the long term, it may not be good for the earth. So we are slowly moving towards this volatile-based anesthetics to the intravenous-based anesthetics, which is much more environmental friendly and futuristic. Anesthesia department is one of those departments which has embraced modern technology of internet and information technology into our practice. Whether it be for patient monitoring, whether it be for viewing investigations, whatever monitoring which we do to record them into systems, the drugs what we use, the techniques what we used, and also reporting of adverse events. All these are now electronicized so that we can learn and provide a safe anesthesia for all of you.